Hello, I'm Dr. Ayub. Today I'm here to discuss about child abuse. The child abuse or child maltreatment, according to the WHO, include all form of physical, emotional, sexual, or negligent treatment, commercial or other exploitation, resulting actual or potential harm to the child's health, survival, development, dignity, and the context of relationship of responsibility, trust, or power. If we see the statistics of child abuse, the commonest abuse is in the form of neglect, followed by physical abuse, sexual abuse, and emotional abuse. The NICE divided child abuse into four groups, which include emotional abuse, that is conveying the inappropriate messages to the child in the form of that the child is not wanted, they are unloved, or they are flawed. The physical abuse include the actual physical harm to the child, beating the child, or the corporal punishment. The sexual abuse is non-consensual sexual act with a child. The neglect include not providing adequate physical need or protection to a child. We will focus more on sexual abuse. If we see the sexual abuse, it is non-consensual intimate activity with a younger child which violates generally accepted cultural rules. It may involve physical contact or it can be without physical contact, such as posing for pornographic photography. These are the different forms of child sexual abuse, which include sexual play, incest, molestation, exhibitionism, child pornography, child prostitution, pedophilia. When we are dealing with a case of child abuse, we have to deal with certain things like the problem related to alleged physical or sexual abuse. In that case, we have to record the physical issues which may be in the form of traumatic injury, unwanted pregnancies, and sexually transmitted disease. Certain psychosocial issues like acute stress, PTSD, acute and transient psychotic disorder, dissociative disorder, somatization, and psychosocial dwarfism. The clinical features of the child sexual abuse include emotional problems, behavioral problems, somatic symptoms. These are the clinical feature or indicator of sexual abuse, which include sudden change in behavior, aggression, age inappropriate sexualized behavior, running away, being distracted, sudden change in the emotional well-being of the child being fearful, anxious, conversion symptom, sleep disturbance like nightmare or night terror, being low, unexplained somatization, drug use, or deliberate self-harm. Sudden changes in social well-being include being withdrawn, deterioration in academics, physical injuries or genital signs, sexually transmitted diseases, and unwanted pregnancies. Whenever there is a indicator sign of sexual abuse, a clinician must be very vigilant and to assist the case for the further management. As we mentioned that the child abuse is something which has long-lasting consequences as the child has a growing brain, and child abuse interfere the growth of the child's brain, which lead to certain long-lasting sequelae. If we see the sequelae of child abuse, this include behavioral problem and emotional problem. The behavioral problem include self-harming behavior, aggression, sexual victimization of other child, inappropriate sexual behavior, including sexual promiscuity, substance use, conduct issue, bulimic symptoms, avoidance, and being withdrawn from other people. The emotional problem include low self-esteem, relationship difficulty, and trust issues. Psychiatric issue in the form of anxiety, depression, acute stress, acute psychosis, conversion, PTSD, somatization, personality issue, eating disorder. It's very important to deal the child abuse or sexual abuse with a multidisciplinary team involving psychiatrist, pediatrician, forensic medical team, and social worker. The psychiatrist has to take the detailed history, mental state, to do the risk assessment, and also pay attention to the risk to other child. The role of pediatrician is to give treatment for any immediate medical issues. The forensic team provide the records of the injuries or any other complication. The social services are involved to provide shelter or supported accommodation to the child. The provision of physical treatment and the safety are the first in dealing with child abuse. So first of all, we have to give the immediate medical, psychological, and social treatment. And we have to also give a certain treatment for which prevent long-term sequelae. The psychosocial treatment includes psychoeducation of the child and the parents, reassurance, addressing behavioral issue, adapting, coping, and problem solving, anger management, parent training, supportive parenting, preventing long-term sequelae. There are some specific psychosocial treatment which are very useful to prevent long-term sequelae in case of child abuse, which include combined parent-child cognitive behavioral therapy to provide positive growth of the abused child and adaptive coping skill, multi-systemic therapy which involves supportive parenting to deal with behavioral issues, child-parent interaction therapy to improve supportive nurturing of the child.